All right, we'll go ahead and get started. Welcome, everybody. I am Erin McKinley. I am the president of the Brand District. Thank you all for joining us this evening. And so this is a CEU talk, so I will be putting in the chat a sign-in link for you to sign in with your CDR number, and I will be emailing out all of the CEU certificates with a link to the recording in the morning. Just a reminder, throughout the presentation, please stay muted, and we'll have a Q&A session at the end of our speaker session today. And just one little reminder before we get started from Land. If you may have seen this email come out, but I'm putting in the chat the link and a little reminder. Land has taken on the task of discussing if our districts are going to move to regions. And so we have a survey. We would love our members of Land and those who happen to not be members of Land to take the survey to let us know what you think about this possible transition. And so I've put that link in the chat for you, as well as I will put the link to sign in. And so if you're a student or you do not want the CEU, you do not have to sign in for this talk. And so I'm going to turn it over to my colleague, Dr. Bailey Houghtaling, to get us started for this evening.
Thanks, Erin, for the invitation to talk with you all today. I'm excited to be here. My name is Bailey, and I'm with LSU and a colleague of Dr. McKinley's. I'm really excited to be here. In my talk today, I'm going to be talking about food environments in general, and then also I'm going to share some findings from some of the applied research that my group has done within the state. And there will be plenty of opportunities for questions, so I'm happy to interact with you all at the end. So just to touch base about the learning objectives, I'm gonna talk about why the food environment is an important sector or setting to explore in relation to diet quality and health outcomes. I'm also going to give a brief overview of some common food environment tools to assess different components of the food environment that are important for consumer behavior, for example. And then, as I mentioned, I'm going to share some exciting findings from some of our research, and exciting in that it gives us a lot to work with for health promotion programs that are currently ongoing in the state. So first, I'd like to answer the question, why food environments? Why should we focus on the settings where people purchase or can access foods? And of course, I mean, all of us are RDNs or RDNs to be on this call. And so we know that Americans' diet quality or their food and beverage purchases could be more aligned with dietary guidance. And this hasn't really changed much in the last 10, 20 years. We also know that dietary risk factors for early death and disability really outnumber some other common risk factors like tobacco use, alcohol and drug use, low physical activity, some other really key public health issues. And so intervening on diet is super important. And I really like this graphic to sort of show why the food environment is important and, you know, why especially it can be complemented with direct nutrition education. And so, for example, this is a graph just showing descriptive data and the rise in obesity prevalence over time. And as you can see, around the year 1975, those lines start to shoot up, and those are men and women of all age groups and racial and ethnic subgroups. So I really like this quote. We believe that it is implausible that each age, sex, and ethnic group with massive differences in life experiences and attitudes had a simultaneously decline in willpower related to healthy nutrition or exercise. So something else is going on, and it's probably related to some of these macro level factors that influence decision making. So this image on the slide really sets the stage for the food environment setting as one macro level issue that deserves attention. We know that combining direct ed with changes to structural factors in the environment or at the policy level can enhance outcomes at the population or individual level. And so these types of approaches are really recommended. And where my work falls and where this presentation is going to focus is more on the physical environments or settings where populations have access to foods. I'm mostly going to be talking about the supermarkets and convenience store settings, but it is important to note that the food environment is really anywhere that food can be accessed, and I'll get into that in just a moment. We also know that really focusing as a field, as a practice on some of these macro level factors can advance health equity outcomes as well. And so if you look at this getting to outcomes framework for increasing equity impact, you can see that both increasing healthy options in the environment as well as reducing deterrents such as food marketing can help reduce the burden of obesity and non-communicable diseases that are disproportionately affecting communities with lower income, communities of color. And so really focusing on this as one avenue towards health equity is really important as well, and is what a lot of my work focuses on. So now that I've told you why the food environment is important, I'll give you my favorite definitions, or the definitions I use most frequently to characterize what the food environment is and what that term means. So if you can think of the food system, right, how our food is grown, how it's distributed, how it gets to us in retail settings, how we use it, and then where the waste products go, the food environment is really where we interface with all of those different systems levels factors. And the source that I use quite a bit to characterize the food environment characterizes built, wild, and cultivated food environments. So wild food environments you can think of as growing spaces. I would probably characterize like wild forests with berries, etc. Like it's accessible food, but it's in more of a wild setting. Cultivated would be things like community gardens, or if any of you are familiar with Atlanta's food forest, that would be more of a cultivated food environment. And then we have the built food environment, which includes retail spaces, as well as the charitable food system. So things like food pantries as well would be considered a built environment. So things that have been constructed to provide populations access to food in whatever form that may be. So work sites, for example, cafeterias, things like that are all part of the built environment. And so when we're looking at either the built, wild, or cultivated environment, and as I mentioned, specifically, I'll be focusing on the built environment, but these are some of the constructs that we are interested in, or at least I'm interested in, right, as a food environment researcher. So things like the availability, looking at whether healthy versus unhealthy foods are even available in the setting or location of interest. Affordability, we know, is a highly important. This can be how affordable healthy products are in general or relative to unhealthy counterparts, for example. Different promotional tactics used to promote either healthy or unhealthy products are also important. And then if you look to the right-hand side of the figure, things like convenience. So the time cost, for example, of the items that are available in a food retail setting, or how easy it is to obtain them in a retail location, could be considered convenience. And one example I would give is when you walk into a store, the things that you see right away are the things that are highly convenient for you to go ahead and grab and get out of the store. So that's also like the placement or proximity of food items would also be captured under this convenience aspect. And then additionally, quality. Things can be available and affordable in a food environment, but if they're not high quality, and particularly talking about produce, we can't expect that consumers are going to purchase them. And so that's also something to keep in mind when we're thinking about changes to the food environment to improve consumer purchasing to be aligned with the dietary guidelines. I will also mention that this framework does focus on sustainability. And so the climate and environmental impact of different food products that are available in the built food environment, for example, Although there are no good tools currently to measure these different aspects of food products in the food environment, so it is something that remains underexplored. Okay, so just to reinforce, food environments are pretty much anywhere where we eat, learn, live, play, shop, and work. Anywhere where we come into contact with food or food promotions is part of the food environment. So it is a very broad term, but I specifically in my work tend to focus on that shop sector there that you see highlighted. So things like stores, convenience formats, things like that. And this is really where my presentation or the examples from Louisiana specifically are going to focus. But there are a lot of other tools and resources for these other settings as well. And so if any of you are interested in learning more about those, I can definitely pass along some resources for some other settings. Okay, so I'm going to move into some research results from two studies in particular. And the first one I'd like to introduce to you is a study where we asked what the availability, affordability, quality, convenience, and promotion of healthy versus unhealthy foods and beverages in food stores were in populations assessed by lower income audiences. We also wanted to know if these food environment properties differed by geography, so urban versus rural, by store ownership, so those that are like corporate chain stores versus your small mom and pop independently owned stores, and then store type. We know that there's a lot of differences between dollar stores, grocery stores, and convenience stores, for example. And so this study was two-part, and this is the first part that looked into some of these variations. So I chose to focus on SNAP authorized stores in particular because we know that the SNAP program serves quite a large proportion of the American population. So about 42 million, or 1 in 8. And I think that number has probably increased as a result of the COVID-19 pandemic, which strained household financial security immensely. So that's also something to keep in mind. There are over 260,000 stores in the United States that are authorized to accept SNAP benefits. Stocking standards for SNAP authorization are pretty, they're not hard to meet. And so we see stores that are grocery stores, some restaurants, for example, some convenience stores do meet the criterion for SNAP authorization. And so even though I focus only on the SNAP stores within communities, most of the store formats available within a community or setting are going to be SNAP authorized because it's not hard to meet SNAP authorization, and retailers are able to access some of that consumer demand for SNAP as well within these communities. So a lot of stores are SNAP authorized. And just to show you this number, the reach of the program in terms of sales data, even though this isn't publicly available to us, we do know through USDA reports that about $63 billion, for example, of foods and beverages were purchased by SNAP households, and that was data from 2017. So the SNAP authorized setting is a setting that is an opportune setting for food environment intervention, and also has policy implications, right? Because SNAP authorized stores have to adhere to stocking standards. And so if we can show evidence that stores need improvement, it could lead to public-private partnerships or potential policy changes to improve food environments for SNAP participants. And so those are kind of like the big picture things that I seek to address in the research that I do. And I don't know if any of you are familiar with the SNAP retailer locator, but the USDA has an online searchable database that will tell you all of the stores that are SNAP authorized within a community or within a state or even nationally. So you can download these databases that give the store name, location information, that can then be matched to determine whether or not the parish that they're in could be classified as urban or rural. So in order to sample for this study to determine if, these variations in the food environment by geography, ownership, and store format, I used the SNAP retailer locator and downloaded all of the authorized retail sites in Louisiana, and then used a systematic and random selection of stores to determine both the parishes that we were going to focus on, because we didn't have the resources to do every parish, which is often true in research studies, and then also to randomly select the stores that we were going to measure. And so I'm showing this Ag Center regions picture because we aimed to get stores from Louisiana in each region so that we could have a fairly good picture of the state overall. And then within each region, we picked the most rural parishes and then the most urban parish so that we could have that comparison. And then we randomly selected a parish that was kind of like in between urban and rural. So at the less of one of those two extremes. And then for those selected parishes, a random number generator was used in comparison to this Excel document of SNAP authorized retail sites to randomly select 5 stores by parish so that we could implement food environment tools to measure some of the aspects of the food environment that I mentioned previously. So one of the measures that was implemented in these randomly and systematically selected parishes and stores, so these SNAP authorized stores, we use the Nutrition Environment Measure Survey in Stores. For any of you that may be familiar with it, it is a paper-based survey. So researchers enter the store usually with a clipboard and a pencil, ask managers or owners, whoever's there, for permission to implement the tool in store. Depending on the size of the store, it can take anywhere between 30 minutes to 45 minutes. In very small stores, it's a rather quick tool to implement. But there is training associated with this tool online. And for that reason, and also because it has been tested previously for reliability and validity, it is considered one of our gold standard food environment tools. It's certainly not the only one. There are probably over 200 to 300 food environment tools available out there. This is one that's most widely used, so it allows for comparison to other research sites that have implemented this tool. And it comes with standard training and a standard scoring protocol. So it was something that we chose to use for this investigation. And the NIMS measures 11 categories of foods, and both healthy and unhealthy, if we're thinking about the dietary guidelines, alternatives among these 11 categories. So milk, fresh fruits, fresh vegetables, ground beef, hot dogs, frozen dinners, baked goods, beverages like sodas and juices, whole grain bread, baked chips, and cereal. And these food categories are admittedly a little bit strange, but the tool was created around the categories of food or the food products that are most purchased by American households. So thinking about what Americans are purchasing, and then if healthier alternatives relative to those products are available, affordable, and high quality. And so you can see, again, I'm showing this framework of these different constructs that we look at for the food environment. And I have those 3 circled because that's really what this tool measures. It does not measure promotion or convenience or sustainability, but it does look at the availability, affordability, and quality of healthy versus unhealthy products. The second tool that was implemented in each of these stores was the grocery promotional tool. This is also a paper-based survey, so implemented in much the same way as the NIMS. It is fairly quick to implement, so from our results, it took about 13-ish minutes on average to implement this tool in stores. And what this tool measures is the placement and promotion of 5 different food categories. And so we assessed candies, chips, sugar sweetened beverages, which might include sodas or Gatorades or sweetened coffees. Any drink with added sugars was considered a sugar sweetened beverage in this research. Child-focused cereals, so cereals with the cartoonish looking characters on them that are really targeted towards child audiences. as well as fruits and vegetables. So it's looking at those typically unhealthy or less healthy food products in comparison to whether fruits and vegetables are placed and promoted to a similar extent. And these placement and promotional variables are measured at the entrance to the store, so within the first 10 feet when you walk in. The end caps both facing the checkout and facing away from the checkout. Checkout settings, so both the side of the checkout and at the end where there's usually those beverage coolers, and then any islands that are technically movable, so no permanent islands, but those kind of like pop-up stands that have products available for consumers. The original Grow Promo tool, I will say, measured more categories. We chose to implement only the categories or the locations in store that are considered the most high impulse, for lack of a better description. And so we know that the evidence suggests consumers make quick decisions, in the immediate vicinity of the store entrance, and also at these high impulse purchasing locations, such as end caps, especially at eye level, and checkouts, for example, which would be considered like the beachfront estate of the food retail setting. So consumers are making a lot of impulse purchasing. So the idea is if we can see if there are healthy options there or introduce healthier options in these impulse purchase settings within retail formats, that we can make small changes to consumers' purchasing habits that can favorably improve diet quality. And then I'm going to go back a slide just to mention, and it may be a little bit small on this slide, but in addition to just measuring whether or not those items are placed in different locations throughout the store, it also measures some promotional aspects like the size of the display. So whether relative to store size, the display is larger than normal, for example, whether it's themed. So thinking if it's like sports themed around Super Bowl time, or Halloween or some sort of holiday theme, and also captures whether or not displays are branded. Does this, like, for example, movable island display also have all of these pictures of Frito-Lay branding, or is it just like this plain kind of wire rack? So things like that. And then it measures child-focused marketing as well. So we want to know if it is less than 4 feet from the ground. So is this product within easy reach of a child that's sitting in a cart or walking alongside the caregiver that's shopping? And is the product branded in any type of child focus characters, like cartoons, movies, Paw Patrol, things like that. And so this tool complements the NIMS in that it measures promotion and convenience factors of foods in the food retail setting. So by implementing both the NIMS and the Grow Promo, we were able to assess 5 out of 6 of these food environment components in the selected Louisiana stores that were SNAP authorized. So to make sense of our data, we just did some standard descriptive statistics, so means and standard deviations. And then our statistical partner also did a multivariate analysis of variance in order to understand if these mean scores differed by urban, rural, by ownership, so whether the store was corporate or chain or independently owned, or between store type. And just to add a little bit of context to those decisions that we made, there is some data to suggest that rural environments compared to urban have more poor or worse food environments. And then there's also data to suggest that corporate or chain-owned stores may have less fruits and vegetables, which equate to a less healthy food environment if you're looking at those variables than some independently owned sites. And that data that I'm thinking of specifically is from the North Central United States. And so that's just some preliminary information that we had. And then we also know that food environments that vastly differ between different food business models. So grocery, dollar, and convenience stores have totally different business models. They're different sizes, different products are available there. And so understanding variations by those stores is also quite important. And so for the stores that were implemented by NIMS and that we used the NIMS and the Grow promo, we did measure 42 stores. And so 75 were originally slated for data collection, but we got interrupted by COVID. And so it was not possible to be able to visit the remaining stores. And so we had to just go with the 42 that we collected before the National Declaration of Emergency back in March of 2020. So just throwing that out there, we did have a smaller sample size than what we had originally hoped for, but there was really nothing that we could do. So 42 stores were measured using those two tools. You can see that the majority of these stores were smaller convenience stores. So convenience stores that are SNAP authorized, followed by grocery and dollar stores. And there was a fairly even split between corporate chain and independently owned stores that were measured in Louisiana. Slightly more were corporate chain owned entities, but we still did have a fairly good proportion of independently owned store sites as well. So this next slide is going to be a lot, and I'll forewarn you, but I'm going to explain it to you. So this table was just taken right out of the publication, but I want to explain it to you. So on the left here for the results, you can see the top possible NIMS score. So the NIMS has a standard scoring criteria that goes from, I believe, 0 all the way up to 54. Higher scores equal healthier food environment. Lower scores equal unhealthy food environment, just to keep it simple. And so you can see that the top possible score, that would mean, yes, scored perfectly on every NIMS component, would be a 54 overall, and then 30 for the availability subcategory. Price category would be 18, and quality is 6. If you're looking over at the table, you can see the first column is that total NIMS score, and then each column thereafter is the subscore for availability, price, and quality. And then if you're looking at the rows, the first row is just in general, all of our 42 SNAP authorized stores. You can see that the total score on average was just about a 13. And so that's quite a bit below 54. And so overall, just a glance at this table, it really tells us that overall the SNAP authorized stores in Louisiana did score rather poorly in comparison to the top overall scores for NIMS. And so that's kind of one takeaway point. When we start looking at differences by those outcomes I mentioned earlier, so rurality, whether the store was in an urban or rural parish, we didn't find any significant differences by NIMS, which was interesting given other research that's shown rural settings might be more disadvantaged with respect to food environments. And so we did not find evidence of that here. We found that like urban settings, rural settings scored pretty much just as poorly, despite having somewhat lower scores on average, but we did not detect statistical significance. We did find sort of the opposite finding of the other research. So when I mentioned about the corporate chain stores having more fruits and vegetables, typically based on research in the North Central United States, we did find that corporate chain stores that were SNAP authorized in Louisiana scored a bit higher than our independently owned mom and pop shops. So that's another important difference. So that we highlighted for implications. And then we also see, and not surprisingly, grocery stores scored better with respect to the NIMS, followed by dollar stores, and then followed by convenience stores, which on average scored about a 5 out of 54 on healthfulness in the food environment. So this is a nicer way to display the results, but I wanted to be able to show you the data. My partners and I made a infographic to share along with some of the extension work that's happening in Louisiana with those key takeaways that I just mentioned. So overall, stores scored pretty low. There were no differences between urban and rural Louisiana, which means that we really need to be targeting both settings just as much as the other. We also need to be targeting independently owned SNAP authorized stores. And so that really highlights where partnerships can be made in some of these extension avenues that use healthy retail or policy systems and environmental change to improve communities where SNAP residents reside. Okay, so since I explained the other one, this one should be less overwhelming, although it's still a lot of numbers and it is kind of hard to read. So I'll just kind of walk you through this one as well. This is the Grow Promo scores or results, and it was the scoring procedures modeled after the NIMS. So it's fairly similar in what I'm showing you. The numbers are a little bit different though. So a top score for the Grow Promo in this research would be considered an 888. And higher scores would mean that the promotional environment is aligned with dietary guidelines. So it would mean that stores are promoting fruits and vegetables relative to these other products like candies and chips and child-focused cereals. Placement is the same, right? So what in these different settings of the food environment, like the entrance or end caps, are fruits and vegetables placed there more often than these other types of products, and so on and so forth for promotion and child marketing. So higher scores are better. Lower scores indicate that the food environments favor these less nutritious products, which is not surprising to see that most of this, that all of the scores are rather low. So on average for total scores among all of our sampled sites was about a 47 out of 888. That is rather low. So this shows us that for the most part, these SNAP authorized stores are encouraging the selection. They're really priming consumers for the selection of those less nutritious products that are high in added sugar, saturated fat, and sodium, for example. We did find some interesting differences. So independently owned stores, contrary to the NIMS research, did score better than corporate or chain owned. And there were differences in like the placement and promotion as well. We didn't find that urban or rural stores scored differently. What we did find is that each one sort of had a different score for the placement and promotion subscore. So for example, rural stores scored better for placement. So that means that in these different impulse purchasing locations, in rural stores, there were more likely to be fruits and vegetables than in urban stores. However, but if we're thinking about the promotion of these products, rural stores were more likely to have larger sized displays that were more themed and more heavily branded than urban stores. And we found that that difference really negated any type of difference in total scores, but still kind of an interesting difference with how stores in these different areas are promoting products. And so just to kind of show it to you in a different way, some of the takeaway points from implementing the Grow Promo in Louisiana, marketing environments in these SNAP authorized stores, we can say scored poor overall. Rural stores had a greater number and variety of these displays with less healthy products and less healthier alternatives like fruits and vegetables. And corporate and chain stores scored less favorably than independently owned sites. And as I mentioned, so the corporate chain sites had a greater number and variety of unhealthy product displays, but the independent SNAP authorized stores had larger branded and themed displays, whereas the corporate settings had fewer. And then another important thing to mention is that we know, right, that grocery stores, convenience stores, and dollar stores are so different. Like if you've been into any one of those stores, you know that there's a lot of differences with what's available, how those stores look. But we didn't find any difference in marketing across all three of these stores, store formats or store types. The marketing environment scored rather low. So that's kind of interesting. Whereas grocery stores are considered these prime food access opportunities and communities, they really don't score better based on the research that we did in Louisiana on aspects of marketing than our dollar and grocery stores. So that's kind of an interesting consideration point as well. So all of the research that I do, I really strive to partner with Cooperative Extension, which is part of the LSU Ag Center land grant university status. And so there are cooperative extension agents in just about every parish within the state that are charged with either doing direct education for nutrition, whether it's a SNAP Ed, AFNEP, or Healthy Community CDC grant parish. And so one of my collaborators, Dr. Denise Holston, the agents that she oversees are really on the ground in Louisiana parishes, facilitating some healthy food retail programs to work with store management to add a greater selection of healthier foods and beverages if we're thinking about alignment with dietary guidelines, and to think about how these items are promoted in store. So all of these results were intended to inform how these healthy food retail programs are designed and implemented over time in partnership with store management. So the Go Shop Healthy program is launching very soon in a few select parishes, and they are hoping to expand more broadly in the long term. So I don't know, maybe some of you will see these Go Shop Healthy signs around. So before I wrap up and get to any questions, I would just like to acknowledge the great team that helped get these results in their current form. And so I've partnered with Dr. Denise Holston and Dr. Melissa Cater, who are both part of Louisiana Cooperative Extension and with LSU. And then my students, Nila, Dejera, and Ali, both past and present, really helped with data collection, data management and analysis, and then also acknowledging the funders and supporters of this research that made doing this work possible. So with that, I'll pause, and I'm happy to facilitate any questions or revisit any concepts for any of you, but I appreciate you having me.
If anyone has any questions, they could go ahead and unmute if they would like. So Bailey, is the plan to try to go back and survey the stores that you were unable to because of COVID to try to add to the data?
That's such a good question, Erin. Ideally, that would be awesome, but we know that the food environment has also changed so much because of COVID. So food prices have changed drastically during COVID. I'm sure many of you experienced, empty shelves when shopping. And so we were considering in the beginning, like when things were, a little bit more approved to be able to move around the state, if you're masked, etc. We just thought we couldn't make that comparison because of those vast changes. It would have been cool. And I think all data is cool. So, and not discounting the enormity of the problem, but it would have been valuable to be able to do that, to try and make some sort of like pre-post comparison. But I will also mention that implementing these tools in stores is incredibly, it requires an incredible amount of time. And so to implement both tools, you need 2 researchers to travel to each store so that one person can be doing one tool while the other person can implement the other tool. And some of these parishes, relative to Baton Rouge, are a couple hours drive. And so being able to fit all of that travel in with implementation time, and then just also the nature of community research. And so, for example, I mentioned at the beginning that we always secured, manager or owner permission to use the tool within a store location. But what happens is sometimes you drive 3 hours to a store location, you get there and the manager owner's not available, and that you're told to come back a different time. And so what we did is just kind of would travel up to 3 times to a store location just to remain consistent and not to bother them too much. But with the time and resources required, it was just something that was not possible for us, but that would have been a really great research approach or question, and a really good questionnaire. Thank you.
Any additional questions?
Hi, this is Melissa Guillory. Can you hear me?
I can.
Okay. I feel like this is great validation of what many of us probably suspect, even before pandemic, and availability of food or limited availability of food. Has anybody done any research on, it feels like taxpayers, resources provide SNAP benefits, and taxpayers' resources provide health insurance for people, indigent populations, which could probably be SNAP recipients. Has there been any study done on possibly a food box that has a prescribed food box that might be a healthy approach, maybe based on area of the country, like a Southwest food box, or a Southern food box, or a Midwestern food box that would be an option versus giving SNAP benefits in a retail setting with unlimited options for choices of redemption?
Yeah, that's such a good question. I think it gets at a lot of different sort of issues or directions in the field. And so I'll start responding to that question by saying that I'm going to answer your question, but in a roundabout way. So sure. I don't think that I'm not aware of any research that really evaluates the feasibility or potential impact of food boxes like that. But what I will say is that what you bring up a really interesting point. SNAP dollars are funded by taxpayer money. It is a USDA program funded through the Farm Bill. So it is a program that requires a considerable amount of resources. And so a lot of times what you'll see is people framing the work that they do with respect to reducing healthcare costs or costs like that at the societal level. So that's one way I see that addressed in the literature. But I think more specifically, historically, the SNAP program has, as you all know, really only aimed to reduce food insecurity and hasn't really touched on diet quality. But there's some exciting changes that the USDA is making in terms of like the resources that they're funding. And so, for example, just this year, the USDA issued a report on supporting nutrition security. So kind of marrying this idea of nutritional quality and food security. So saying that all Americans should have access to food, but that food should also be nutritionally beneficial. So some of the ways in which USDA is advancing the concept of nutrition security is through improving funding to some of our SNAP Ed implementing agencies to help with technical assistance. So things like Cooperative Extension, for example, so that there's more resources for agents to help some of these macro level changes, like changes to the food environment through healthy food retail changes. And then there's also a lot of different types of programming that are being tested at smaller sites across the nation that hopefully will gather evidence in the long term to be a consistent part of SNAP benefits. And so one of those examples are nutrition incentive programs. And so, for example, in some areas of the country, models are being tested for at farmers markets and or retail locations. SNAP participants, if they make a purchase, for example, there's different models, but if they make a purchase of fruits and vegetables, or if they make a purchase using their SNAP benefits on any food product, they're given additional dollars to use only on fruits and vegetables, whether that be fresh, frozen, or canned. And so it really improves the affordability of those items in the food environment. And what we're seeing is that equates to more purchases and some of this preliminary data and improved diet quality, which can then get at some of these longer term healthcare costs that you're talking about. And then another model that's being tested with similar populations are produce prescriptions. So again, these are only at a few select sites across the nation, and they're currently grant funded. But the idea is that with enough evidence that these can become more consistent parts of social benefit programs where physicians are prescribing fruits and vegetables, and then with that prescription, participants can use the vouchers to get fruits and vegetables at farmers markets or retail locations. And so I think even though these, and the last thing I'll say, because I could go on forever about this probably, the last thing I'll say is that another thing that these initiatives do, so this focus on nutrition security, this improved technical assistance, these different types of nutrition incentives that improve the affordability of these different options for lower income populations, they really help to improve communities overall, or they have the opportunity to improve just community settings overall, because as I mentioned before, SNAP authorized settings are typically just, the grocery stores, the convenience stores, the dollar stores that are already available in communities. And so these changes, although, population specific, can really help to improve just the overall food environment in general, and ideally long-term diet quality, et cetera. So I would probably argue for these types of changes, in my opinion, versus some sort of standard food box, because the implications or the impact has a wider reach and can potentially be more beneficial. But yeah, all great points. And thank you so much for bringing that up, because I think it's a really important discussion topic.
Thank you for your thoughtful response. And thank you for your passion and your work. This is great.
All right, any additional questions? Well, if that's it, I thank you all for joining us this evening. We had a really great group. Thank you, Bailey, for telling us all about your work. So interesting. Can't wait to hear more as you do more. And I'm putting in the chat again the CEU certificate sign-in. If you are wanting to get that from us, we will be mailing those out in the morning. And then if you are a brand member, we will be having a social in the month of May. We'll send out that information once we have it. But thank you everybody so much, and have a great evening.